Right. So yeah, thanks so much. Thanks for having me, and apologies if I stumble my way through this at 1:22 in the morning here. So yeah, a bit about me. Qualified as a doctor in 2000. Did basic surgical training first before my GP training in Nottingham, and then I worked for the MDU as a medico legal advisor for a couple of years, and then I was a GP for about 10 years after that, and for a bit before then as well. I was a medical student educator and registrar supervisor. I did a lot of out of hours and a lot of locum work, and I was a GP appraiser for the last sort of 3.5 years of my before we left the UK essentially and moved to Australia in July 2019. And I, as you rightly said, I did my law degree in Nottingham again, and was called to the bar in 2014. And medical leadership side of things, I was on the LMC in Nottingham for 5 years, and I was the vice chair just before I left, and had to resign from that role because obviously couldn't manage that from so far away. I also worked for NHS England for a couple of years as an assistant medical director for the kind of East Midlands region. And I was medical lead for Nottingham Urgent Care Centre in the city just before I left. And I did my coaching certifications and diplomas and things while I was in Australia, and finished that, qualified as an executive coach in September last year. And since then I've been working, because I'm not registered to work here in New Zealand as a doctor. So my wife's a maxillofacial surgeon, so she works full time, and I look after the children when they're not at school and the apartment, and do my coaching and leadership development and things like this. And I've got a special interest in helping the victims of bullying, and this is how the assertiveness side of things has come in for me, because often victims of bullying end up with a rock bottom confidence, and an associated lack of assertiveness. So and links to Derby, I did a 6-month job at what was Derby City General Hospital before they merged, long time ago, 16 years ago or something. And I did quite a lot of locum work at Charnwood Surgery in Derby City Centre about 11-12 years ago. So, and I know lots of good GPs who have been on the Derby VTS, so it's a really good scheme as far as I know. Okay, so these were very kindly provided by Julia. The objectives of the webinar to understand what assertiveness is and how this differs from non-assertiveness or passivity and aggression. Recognise the benefits of assertiveness, be able to identify situations where assertiveness would be helpful, and feel more confident instructing a response when communicating assertively. So Julia's really already done this, but just a little bit more detail, I think. What is assertiveness? It's a social skill that relies heavily on effective communication while simultaneously respecting the thoughts and wishes of others. People who are assertive clearly, calmly, and respectfully communicate their wants, needs, positions, and boundaries to others, and they're able to say no guiltlessly. Individuals who are high in assertiveness don't shy away from defending their points of view or goals, or from trying to influence others to see their side, all the while maintaining their self-control. So they don't lose it. They're open to both compliments and constructive criticism. And I was going to say, does this sound like you? Well, from the poll, it looks like we've got quite a lot of assertive members of the group, so that's really fantastic. So not too much for you guys to learn. So are you potentially more aggressive than assertive? Well, you're all GP trainees, so I'm sure most of you are not like this, but I'm sure that each and every one of us could name a doctor that we've worked with who we think is aggressive. Some of these traits may include using offensive language, telling instead of asking, ignoring or trying to shame other people into submission. These are all actually traits of bullying as well. Being pushy, frank bullying, acting a superior way, being intimidating, or even physically threatening. Does this sound like you? Probably not. But perhaps just as pertinently, does it sound like some of your patients, some of your colleagues, or even some of your loved ones? Because, you know, sometimes these things happen in life. And do you respond to their aggression in a non-assertive or passive way? Conversely, are you more passive than assertive? Do you let others lead and make most of the decisions? And do you find yourself making excuses for this? For example, by convincing yourself that you let that happen for a quiet life? Do you lack confidence? Do you belittle yourself? Do you put yourself down? We all have lots of negative thoughts and inner critic, and the vast majority of our thoughts each day are negative. So it's whether you listen to those or not. Are you a people pleaser, which most doctors are hardwired to be? And I have a very short video here by Dr. Julie Smith, who is a psychologist, and she is just going to outline four characteristics that she feels are that people pleasers have. Bear with me a second. Now here we go. Phew. Right. So there will be some adverts because it's not. How can I get out of this?
We can't hear that, Adam.
Okay. All right. Well, we'll abandon that then. Can you hear me still?
We can read the bits on the top. Yes, we can hear you.
Well, it's probably not quite the same. Okay, sorry about that. Right now, let's try and get out of that and go back to the presentation. Okay. Well, I'll obviously send you the slides and things, and you have the recording, so you'll be able to look at that if you want to. It's only like 37 seconds long or something. Okay, so do you, oops, I'm just trying to move the little box down there. Do you get sucked into playing the rescuer role in drama triangles with patients, colleagues, or friends? And common things here for doctors. Do you struggle with saying no? Do you apologise all the time? For example, saying to patients, "I'm sorry to have kept you," instead of "thank you for waiting" when you're running behind. Do you regularly let people cross boundaries that you've set? Does that sound like you or some of your patients or colleagues? And from the poll, it looks like a few of you are in that category. And this is just quite a helpful summary table that I found with the headings passive, assertive, and aggressive, and a few of them that are kind of quite good are if you're passive, you're scared to speak up, others attack you. Assertive, you speak openly and honestly. Aggressive, you interrupt or talk over others, and you have an attacking way. Passive people speak softly, assertive people speak firmly and at a conversational level, aggressive people speak loudly. Passive people, your self-esteem is reduced. Assertive people increase your self-esteem, and aggressive people reduce other self-esteem. So that's just a few things there. That's something for you to look at later on. So why is assertiveness so important? What are some of the benefits of assertiveness? So there's a greater sense of agency, so being able to kind of make decisions for your self-control, your own destiny, etc. Better relationships at work and in general, as we've seen on one of the earlier slides. Assertive people and assertive communicators are very respectful of others' viewpoints, and they're very good at listening. They're very honest, and that's really valued. So that those sorts of traits are seen as very attractive, and so that leads to better relationships at work and with others. You get higher self-esteem and confidence with assertiveness, and those kind of buoy each other on. Less imposter syndrome, lower rates of anxiety and depression, and safer and more productive conflict. And that might sound a bit strange, but conflict in the workplace, if dealt with in a safe and safe space, can be very, very productive. And in order to kind of move things along, if you had a room of partners in a GP practice and they were all passive, then probably nothing would ever be achieved. But for innovation and creativity, you need to kind of bounce ideas off each other and respectfully disagree with one another at times. And you can only really do that if you're assertive. But what are the personal and professional costs of not being assertive? So you can be sensitive to criticism, you can be insecure, have low self-esteem. In extreme cases, and I'm sure we've all seen patients like this, you'll see some people who come in through the door, usually with an overbearing partner or something like that, and you're trying to elicit history from them, and get information from them, and the partner is domineering them and speaking for them and so on, and it's just, well, you perish the thought to think of what's going on at home, really. Then maybe being treated like an emotional doormat whose needs always come second. I say that's usually more of a personal thing than a work-related thing. Obviously at work, if you are not assertive, and therefore patients can kind of get whatever they want, and create loads of work for you, and your colleagues can create loads of work for you, that obviously is linked to burnout, but obviously not necessarily, but certainly stress, anxiety and depression as well. However, there is some good news, and this is definitely easier said than done, and it takes a lot of time and effort, but we can definitely improve our assertiveness through learning techniques and practicing them. So it does take time, but the more you kind of practice on patients and colleagues, the better, and less kind of apprehensive you'll be about it as time goes by. The more assertive you become, the more confident you become, and the cycle continues whereby your increased self-confidence improves your assertiveness, etc. So how can we become more assertive then? So physically, assertive people tend to project confidence, and you are talking about Amy Cuddy, Julia, and she's very famous for the Superman and Supergirl poses. I'm not suggesting you do that in front of all your patients or in front of your colleagues, because that might just start proceedings to section you under the Mental Health Act. But certainly, there are certain postures that are the kind of upright and not hunched, and not kind of in a ball and subservient thing. And that goes with maintaining eye contact, and using your body language effectively. And with regards to the eye contact, that can be really key to reinforce a no message. So there are a few visual cues. There are a few visual cues that are more effective at letting someone know you mean what you say, that are better than direct, uninterrupted eye contact. So verbally, how can you be more assertive? So assertive people are able to express their thoughts, feelings and beliefs honestly and reasonably. So they're very open people, very honest people, very transparent. They can concisely state what they want from the other person. They also listen very carefully to that person's response. They respect others' thoughts and feelings. And the advice here is don't argue or attack if you sense resistance. Just try to keep your cool. If you get into the kind of arguing or attacking mode, then you're verging into that aggressive territory, and moving out of the assertive side. And this is more relating to patients, but I think if you reach a stalemate where there's no possible compromise, so patient asks for something, you say, no, I can't do that for you, and they're just, it's just kind of going on, it's going around in circles, rather than giving in and being passive or arguing with them and being aggressive. I would just suggest that you say, well, we'll have to agree to disagree. I suggest you go and see one of my colleagues, and they can, kind of depersonalize it and, diffuse the situation and so on. So a few other sort of linguistic / psychological tips. Address people by their name. So we've all, I'm sure, worked for people who haven't known our name, and they will just bark orders at us and tell us to do stuff, and you just feel completely disrespected and pretty worthless to them. They've got no interest in learning your name. So it shows to the person that you're talking to that you know who they are and that you're directing your assertive comments at them. The use of I statements to get your messages across firmly, such as I want. Accusatory statements tend to begin with you. So when you're saying to people, you do this, or you shouldn't have done that, or whatever, then that's going to lead down that argumentative pathway, I think. Avoid words that exaggerate, such as always and never. For example, this is the third time this week you've delegated your work to me. Would be better than you always give me your work, because that person can then just turn around and say, well, actually, I didn't give you my work yesterday, so that's not true. So you're just basically opening a rabbit hole there for an argument to ensue. So use facts rather than judgments, such as saying this article about has information about X missing, rather than you've done a bad job on this article. And that's, when you're kind of talking to students, or if you're in managerial position, direct reports or other colleagues. And use clear-cut verbs so your messages get across. For instance, instead of saying could or should, you can say will. Rather than using need, you can say want. For example, I want to attend this conference because. So I think the most common and most useful thing really for assertiveness is how to say no assertively. This is probably the thing that we're struggle the most with, and is the most common sort of situation that we find ourselves in when patients and colleagues are asking us to do things that we don't feel comfortable with. So I would always say, if you say yes to everything, what are you subsequently going to have to circle back and embarrassingly have to say no to? And this goes for personal as well as work commitments. That we can overcommit ourselves, saying, we're trying to be helpful with our friends and family. Yes, I'll do that. I'll pick that up for you, and I'll take you here and whatever. And it's like, well, at what cost? The only person that's actually going to suffer is the person who's saying yes to everything. But in terms of work things, I don't know. Say you've got a colleague who has to leave urgently because their child's unwell or something like that, and they're like, can you look at my path? I've got some urgent path results coming or something. Can you look at them for me? And then as the day goes by, you're saying yes to so many things, yes to so many referrals that you'll write, and yes to so many things that other colleagues are asking you to do. That the nurses that come in who know which doctors are the ones that will always say yes to them, and they will repeatedly come to you, and your burden just grows, and then you get so sort of snowed under in the pile of yeses that you've agreed to of your own, that you either forget about your colleagues' work, or it's kind of deprioritized in favor of your own work, and then you're in that difficult position the next day where you say, oh, actually I didn't look at those results for you. But I think it's not just about declining a request, it's also about telling someone that they've crossed a boundary. So people who have verbally abused you, or you've had unwanted physical contact from patients, which I've had, bizarrely, and colleagues, unwanted physical contact from colleagues, certain settings where that's more common than others. And then you just have to be assertive and just say, no, that's not okay. You know, remove your hand from my leg, or whatever it is, or don't speak to me like that. Or you know, if you're going to swear at me, then we can't proceed with this consultation. I'm going to have to ask you to leave. So either calm down and let's reset and start from scratch, or these are going to be the consequences. So there are unhelpful beliefs that prevent us from saying no, and this is why we're we're hardwired, even more so as doctors, to be agreeable and try and please people. Because as we grow up, our experiences teach us that we can't usually decline requests. It seems to be impolite to decline requests. So as a result, we may end up with unhelpful limiting beliefs or narratives, you know, our stories that we're telling ourselves that, you know, we shouldn't say no, really, we shouldn't decline that. We should, you know, always try and say yes whenever we can, which increase our difficulty in saying no. So, for example, we may think that saying no is rude or hostile, or will upset people, or is nasty and selfish, or will cause people to dislike me, and, you know, none of us want to be disliked, is against our belief of always trying to please everyone. So these are obviously very unhelpful things that are sort of ingrained in our psyche. But we can turn that on its head and start believing these helpful beliefs about saying no. So if you've noticed you experience any of the unhelpful ones holding you back from declining requests, try these instead. They're almost like affirmations. Say to yourself, by saying no, I'm declining the request, not rejecting the person. I have the right to share my opinions even if they differ from others. The other person is unlikely to take it badly, and they'll most likely understand. So that one, I think, is we tell ourselves a story that if we say no to someone, they're going to take it badly and they won't understand, when really that's just a story that we're telling ourselves that we choose to believe. We don't have to believe that. And this is probably my favourite. If people have the right to request, I have the right to decline. I think that's fair. So I found this on a website. It's cropped. So sorry about the random kind of 7/8 of a face in the bottom right hand corner. But it's just a summary on how to say no assertively. So if you find it difficult to say no, follow these important guidelines. It's actually from the American Management Association website, I think. I've actually put the reference at the end. Know what you want to do and what you can do. That's more a kind of corporate thing. But in terms of kind of healthcare, these ones are a bit more relevant. Say no firmly and calmly. Use the word no as the first word of your response. Give a brief, clear reason for the refusal. Avoid long excuses or justifications. Suggest an alternative for satisfying the request. Boycott the words "I'm sorry." Be consistent in words, voice, and body language, and reinforce the no message through eye contact, like I mentioned before. So I'm just going to go through some of those in a bit more detail, because I think it's worth spending a little bit more time on these techniques, because this is really what you need to take away, I think, from this session. And again, sorry for the slides being wordy. I know that some of you will be recoiling in horror at the number of characters on that slide there. I will be reading them out, but then you will get sent them as well if you want them. So one of the points was saying no firmly and calmly. So saying no and then waffling about your preferences or your bandwidth. suggests that your no can be massaged into a yes. So avoid doing that. And it's very key to stay calm, because if you get angry, that just completely undermines your logical argument for declining the request. Once you start getting into a fury, it's curtains. So use the word no as the first word of your response. I don't think I can get to it can easily be perceived as maybe I can get to it. The exact scenario you're trying to avoid. So an unemotional no at the beginning of your answer shows resolve and is respectful and firm. It's good assertiveness. Give a brief, clear reason for the refusal. I have an urgent deadline that cannot be rescheduled is almost impossible to argue against. So make your reason for the no reasonable and unbreakable, and keep it brief. This kind of segues nicely into the next one. Avoid long excuses or justifications. I have all these meetings, I need a little time between them, I have a lunch appointment, then I have to make a phone call, got to take the cat to the vets, and then I've got to pick up the dry cleaning. Sounds busy, but also suggests that you know how to open windows in your busy schedule to accommodate unscheduled requests. Suggest an alternative for satisfying the request. If there's a reasonable alternative solution to the request that you can propose, please do so. It will assuage any guilt you may feel, although you shouldn't be feeling guilt at saying no, as we've said. But it may well be appreciated by the person who made the request, and so we have those situations, patients come in and say, I need this painkiller, I've got to have it. You feel really uncomfortable about prescribing it, but you may be able to find some kind of compromise. Well, I can't, I'm not licensed to prescribe that medication for you, but I can prescribe you this instead. It may not work as well, but it'll tide you over until you get someone who can prescribe such and such for you. They don't always appreciate that, but on the odd occasion they do. It can also decrease the likelihood that declining the request will come back later to haunt you if you've done something for someone. Boycott the words "I'm sorry." The natural tendency for most of us, especially doctors, when declining a request or demand is to apologise. But in doing so, you're setting a trap for yourself and signalling a weakness to the person making the request. You're giving them an in there. You can say no and still be a nice person. It doesn't make you a bad person. Okay, so stay strong on that one. Stay firm. And finally, on these wordy slides, be consistent in your words, voice, and body language. Inconsistency also conveys weakness and indecisiveness or indecision. This lays the territory wide open to a counter argument in the other person's favour, meaning you've allowed them to take one more step towards breaking through the boundary that you've set. So consistency is key. So, and I'm not going to do too many examples because we're going to do that after the break, but I do have a couple of really basic ones. So a colleague approaches you and asks if you can attend a meeting in their place because they've double booked themselves, but you have a list of work you need to get through urgently that day. So the aggressive reply would be, absolutely not. You always do this. You need to learn to manage your own workload rather than bothering me. A passive reply would be, yeah, of course I'll do that for you. Anything I can do to help. And then an assertive reply would be, unfortunately, I can't attend the meeting because I've got lots of work to get through today. I suggest you ask someone else. But what if they won't take no for an answer? So if the person initially doesn't accept your no, keep repeating yourself, hence utilising a technique known as the broken record no. It can be used in a wide range of situations and is especially useful for persistent requests. Remember, you have the right to say no. And certainly if it's something, like a medication request and it's not clinically indicated, or your license doesn't cover you to prescribe it or whatever, then you're on very, very firm ground with your saying, your right to say no. But either way, if you don't feel comfortable with something, you have the right to say no. They can always go and see someone else. If you really struggle to say it, it's likely that you're overestimating the difficulty the other person will have in accepting your refusal. So you're building it up in your mind that they're going to be really difficult about it if you say no. But again, a la Brené Brown, that's just a story that you're telling yourself. You have there's no foundation for you to believe that. You just made that up in your head. So any thought is something that you can choose to acknowledge or ignore. So the broken record, no example. Could you please take my place in the meeting today? Unfortunately, I can't attend the meeting because I've got lots of work to get through today. Perhaps there's someone else you can ask. I've asked a few people already. Maybe you could just go for the first half an hour. I know that it's important, but I won't be able to go this time as I really need to finish this work today and I don't have any spare time. Not even 15 minutes. I need all my time to focus on this work. You see how that could, at any of those stages, we could have buckled and just gone, okay, go on then. It's only the first half an hour. I'm sure I can, it's fine. I'll, stay half an hour late and finish my work or whatever. And that's just what we do. But the only person that's going to suffer from that is yourself. So I just want to, so I'm just going to do this one and then we will discuss some scenarios when you guys have had a break. Actually, I think I've kind of cantered through it. So when might you need to turn on your assertive mode? And the great thing about these skills is that they're relevant and transferable to different scenarios, from personal ones to work-related ones. Personal scenarios can include interactions with your partner. I'm sure we can all think of times where we could be assertive with our partners. Family, I'm sure our family would take advantage of our good nature if we let them, and friends, our acquaintances. And just writing this reminded me of one of Dr. Rachel Morris's You Are Not a Frog podcast episodes called Very Nice People and Other Deadly Perils. And it's a brilliant episode if you get the chance to have a listen to it. But it's basically very nice people. They seem like they're very nice. And they don't really think it's particularly particularly offensive, but they will kind of take up a lot of your time if you let them. They'll kind of like chew you off on the phone. And the thing about VNPs, as they call them in the podcast, is that you don't really get anything out of that relationship yourself. But they get a lot out of it. They get to kind of like get your opinion and get to sound off, but you come away from those sorts of conversations feeling very drained and very like, what was the point of that? And I really wish I hadn't taken that call. But yeah, I'd really recommend you have a listen to that. It's a great podcast. And when might you need your assertive mode at work? Interactions with patients, for sure. Interactions with patients' relatives, and with our colleagues. And by that I mean primary and secondary care colleagues, our practice colleagues. We have all sorts of interactions with practice managers and nurses, as well as our GP colleagues. And clearly, as Julia's mentioned, our secondary care colleagues can be very tricky at times as well. So I thought I might leave it there.